Hello everyone. This is one video out of a series of videos that talks about various kinds of birth control methods. It's important to realize that this is basic information. It's really important when you decide that you want to go on birth control that you get an appointment with your healthcare provider. You talk about your medical history because sometimes there are things that are contraindicated in using various kinds of birth control, and that you have that more in-depth conversation about what is going to be best for you. So just realize that this is just basic information about various kinds of birth control, and this is just one of them of a series. I hope you enjoy them, and again, if you have any questions at the end, don't hesitate to email me. Thank you. Hi everyone, Lori from Women's Health on the Go. This video is one of several about different birth control options, and this one is about the Nexplanon. Nexplanon is a device that is inserted and I'll show you on your arm. Here is a picture of it. Hopefully you can see it okay. It's just a little plastic device that is actually placed just right underneath the skin in your arm. It is an office procedure. It's done under sterile technique. It's fairly quick and fairly easy. It is a progesterone only. So if you've seen my other videos about the Mirena and Skyla IUDs and the Depo-Provera, which are all other progesterone onlys, they have the same kind of side effects. One, your bleeding pattern. I don't know. I can't tell you. I can't predict what's going to happen. For some people, they don't bleed at all. Others, they still get their period. And then others, they have irregular spotting or bleeding all the time. It's very hard to determine what is going to happen. Some people gain weight with this. It could be 5, it could be 10 pounds, it could be nothing at all. It's really hard to determine, but weight gain is one of the side effects that a lot of people want to know about. It is only progesterone, there's no estrogen, so you have to make sure that you take a calcium supplement because estrogen keeps our bones nice and strong, and now you're only having a progesterone only type of birth control, so you have to supplement that by taking some kind of calcium supplement. Estrogen keeps our bones strong, and as we get older, we have a higher risk, especially when we go through menopause. We don't have that estrogen anymore. We have that risk of our bones becoming frail and getting what we call osteoporosis, which puts us at risk for fractures and breaking bones. So that's the reason why you need to make sure you take a calcium supplement when you're using this form of birth control. Fertility. Now, this is something that I always want to make sure that I tell everybody when they want to do this option because I think it's really important. Let's suppose now it's good for 4 years, but let's suppose in 2 years you say, hey, I want to have a baby. What do I want to do? I want to get it taken out. Your fertility may come back the next day. It may take a year or so for it to come back, and I think that's really important for people to know, especially when they're long-term planning their life. Sometimes people know, I don't want to have a kid for 5, 10, or I don't want to ever have a kid ever at all. So those people, it really doesn't matter. But if you're really kind of planning and you're thinking to yourself, well, maybe in 4 years I'll be ready to have a child, just know that when you have it taken out, one, it can come back right away, or sometimes it may take a little bit of a while to get your fertility back. So I think that's something really important to know. One other thing is insertion is fairly easy. Getting it removed can be easy, but it can be also really difficult. There are a lot of people that it really depends on how good the insertion was done, will depend on how easy it is to remove. Sometimes people it's very challenging to get removed, and that can be very uncomfortable. So that is something to think about when you're going to get this option, just to think about in the future. So that's Nexplanon in a quick, basic way. I hope this information was good, and I hope it helped you make a little bit better of a decision of basically what you may want. I hope it was good. If you have any questions, please do not hesitate to email me. And thank you very much for watching my video. And remember, women's health matters. Thank you.